One of the key elements of our strategic plan for fiscal year 24 is to develop a best-in-class experience in the emergency department. And that's really important because the emergency department is oftentimes the front door of our organization. Approximately 18 to 20,000 patients a year visit our emergency department, and for many of them, this is the only time that they visit CMH, or it's the first time that they visit CMH. And so we want to make sure that the experience that they get is not just good, but it's the very best that it could possibly be. In 2022, we made the decision to go away from a staffing group and to employ our own physicians. We were really excited when we hired Dr. Butvilas to be our medical director for the ER, and we were also able to bring on a great group of physicians, all employed by CMH, and mid-level providers, many of which had been here before, and patients had come to trust them over the years. And so we really assembled an all-star team in the emergency department that we're really excited about. Today, Dr. Keith Butvilas and Denise Silva are going to share more details about the improvements we've made in our emergency department to improve the customer experience.
Yeah, so our best-in-class experience for our patients, first and foremost, one of the processes that we changed to help develop that is a direct bedding process. We've essentially eliminated our waiting room, and so we created a no-wait emergency room. One of the things that we are very sensitive to is patients lead very, very busy lives these days. Emergency department is an unplanned visit for them. And this is not something that they a lot of times look at as part of their day. It's an unexpected event, and so we want to be able to provide care for them as expeditiously as possible, while also recognizing their time is important, and we want to be able to get them on their way as quickly as possible. And so we created a culture to do that. We are bringing them back to rooms, getting them in front of our providers immediately, and getting their workup started so that we can get them on their way or admitted or wherever they need to be for further treatment. So in 2022, we averaged about a 6 to 7% left without being seen rate. And what that meant is patients would come in, they'd get seen by our nurse, our triage nurse, and they would get placed back in the waiting room waiting for a bed. About 6 to 7% of the time, the patients would get tired of the wait and they would leave. For 2023, we are trending close to a 0% rate with our new processes that we've implemented, bringing patients back immediately, getting them in front of our providers. We are currently trending right just above 0%, but certainly on most days, we actually trend at 0% left without being seen before patients are being seen by our providers and treated. The national benchmark for best in class is a trend at 1.5% or lower. And so that was our target goal. We've beat that goal here at CMH and continue to trend well below the national standards across the nation. In terms of the future, we are going to continue to trend that direction. We're going to continue to enhance the services, continue to get the patients in front of the providers as quick as we can, and really provide an experience for our patients that they are not going to be able to get anywhere else.
I take it as a challenge being a charge nurse because I want that number low as well. Because it just makes a better experience for the patients when they're in and out and know what's going on, or hopefully the direction they're going. We are here for the patients. It's to get them seen in a timely fashion, compassionately. We have to work together as a team in order to get these numbers down to where they are, because without working as a team, we're not going to get there. It takes all of us usually helping each other, good communication with the doctors to serve our patients for the best that we can.
To have a best-in-class experience in the emergency department is really an all-hands-on-deck approach. It starts with the physician leadership and also all of our staff members in the emergency department, but really it's more than that. We depend on our lab team to get results for our patients, our radiology team to take images timely and accurately, and so really it takes all of us to be able to accomplish our goal. So one of the limitations that I know that we have is the space of our physical capacity. So we know that we don't have enough rooms for the number of patients that we're currently seeing and will be seeing in the future. We recently went through a refresh of our emergency department. That was really just to get us through until we get to our hospital expansion. A key driving decision of moving forward with our hospital expansion was the need for us to increase the size of our emergency department. In the hospital expansion, we're going to see our emergency department increase significantly in size so that we have more rooms to treat our patients, which will just complement the great work that our staff are already doing.